Hi, ladies. We're going to be doing our Zoom slides on medicine and ethics. I know that on medicine and law, I actually just put the slides up for you to read, but these we're going to do a little bit different. So I'm going to share my screen for you. Here we go. Okay, I know this says chapter 7, but I believe Jada, Penny, and Miss Lisa, you guys, it's not the same chapter. I just didn't go and change the chapter numbers. Let me see. What is your chapter for that? Sorry. Well, I don't have it written down. I want to say chapter 4. So it may not be though. All right, but anyway, it's the medicine and ethics chapter. I'm going to open up the new book and see for our 14th edition students, it's going to be chapter 5. Okay, so in Jada, Penny, and Miss Lisa, it's chapter 5 for you, and the name of it is Healthcare Ethics. So you guys remember, I'm trying to merge two books that are somewhat different, not completely different, but you know, they've changed some things. So let's get into our medicine and ethics. Legal, ethical, and moral issues. The definition of ethics: thoughts, judgments, and actions on issues that have implications of moral right and wrong. Something that is legal is not necessarily ethical, which blows my mind, but it's the truth. To be able to treat all people ethically, you first must examine your own values, beliefs, and actions. And remember, when you're in a facility, when you're in a medical setting, we talked about this the other day, your ethics are your ethics, but you have to follow those of the practice that you are employed by. Personal, professional, and organizational ethics. Medical assistants not only must have a strong knowledge base about ethical issues they might face throughout their careers, they also must come to terms with some of the deeply rooted value systems that have been a part of their lives since youth. All contribute to the way the medical assistant approaches the patient. You must not force your personal ethical beliefs on the patient or the family members. And organizations will offer ethical guidelines in the form of policies and procedures. So there's where you're going to find how you need to proceed in your career where you are. Is they're going to give you policies and procedures in which they expect for you to abide by. Personal ethics in the profession. Personal and professional ethics must be kept separate so that patients can make their own decisions regarding their health care. Professional organizations offer ethical guidelines, and each medical assistant is required to maintain patient confidentiality. Whether you agree with the scenario or what the patient has decided or not, it's really not your lane, and it's unprofessional to then discuss that with other people in the medical office. Okay, this is just some procedures that are going to help you. They're in your book. I have those assigned, so we're gonna go ahead and just skip this slide. The history of ethics in medicine. One of the things that you need to know that ethics are not etiquette. Ethics was started by the Babylonians. Then we have some things that actually lend to that. The Code of Hammurabi, the Oath of Hippocrates, the Oath of Hippocrates, and there's always a code of medical ethics. An assignment that I'm going to give you is I want you to actually look up the Code of Ethics for administrative medical assistants. Hang on just a second, guys. Hey, Connor, baby, you got to go somewhere else with that. I'm recording for my class here, and they can hear that. Sorry, buddy. Find another plug-in. Sorry about that, guys. Okay, so your assignment again is to look up the Administrative Medical Assistant Code of Ethics, and I just want you to give me 5 key points. So that is your assignment that you're going to turn in to me under comments on this particular slideshow. Okay, so let's talk about what is the difference between ethics and etiquette. Etiquette refers to courtesy, customs, and manners, whereas ethics explores the moral right or wrong of an issue. Okay, what is the Code of Hammurabi? It elaborated on the conduct expected of a physician and even set the fees a physician could charge. Thomas Percival developed the Code of Medical Ethics and was interested in the study of how ethical concepts related to medicine. Those are just some key points and some extra questions to kind of give you a little bit broader view of ethics and etiquette. Okay, the history of ethics in medicine. The American Association of Medical Assistants, the AAMA, has written a medical assisting creed, which can be used as a guideline for medical assistants facing complex and ethical and moral work issues. Individuals who are applying to or who have earned the CMA credential are expected to follow a code of conduct for CMAs. Certified Medical Assistants is what CMA stands for. And the AAMA is the American Association of Medical Assistants. Now, we are not the same kind of medical assistants that the other class is. You know, they do blood draws, they do temperatures, they do blood pressures. When you're hired in a facility, can they cross-train you to do that? Yes, they can. But otherwise, it's not in your scope of practice. Now, first of all, I want to say something to Miss Sue. Miss Sue is a CNA, so would she be able to have that as part of her scope of practice? Absolutely, because she's been trained in those areas. So I want to remind you again that some of these things are crossing over to medical assistants that the other Miss Marcia teaches up the hall, and their scope of practice is different. But in this curriculum, some of these things kind of cross over. Making ethical decisions. You have to understand elements of ethics. You have to know what the practice expects for you to do in certain situations. There are different types of ethical problems that you're going to have to know how to apply those policies, and you're always going to have to make good decisions. Form opinions on issues. This section enables the medical assistant to recognize the types of ethical problems that might arise in the physician's office and provides a pattern to follow in making an ethical decision. So again, that goes back to those procedures and policies that you're actually going to be receiving wherever you're hired, and you really have to apply those policies in your decision making and the opinions that you're forming just for your facility. Because remember, guys, what your personal views or ethics are cannot cross over to what your professional ethics are. If you cannot cross that over, then you really need to think about the position that you hold in the physician office that you're working for or facility. Elements of ethics is duty, non-malfeasance and beneficence, fidelity and veracity, justice, reparation, and disposition. So we're going to talk about what is the difference between non-malfeasance and beneficence. Non-malfeasance means refraining from harming oneself or another person, and beneficence means bringing about good. When I see beneficence, I always think of benefits. So that means bringing about good. So who is Dr. Ruth Portillo? She's an authority on ethics in medicine who wrote Ethical Dilemmas in the Health Professions. Have you ever heard of Dr. Ruth? I can remember growing up, being in my teens and up into my late 20s. In the actual newspaper, there was always a Dr. Ruth section, and I always enjoyed reading that. She actually gave advice on many, many different problems. What is the difference between fidelity and veracity? Fidelity is the concept of keeping promises, and veracity is the duty of telling the truth. Justice relates to the fair distribution of benefits and burdens among individuals or groups in society having legitimate claims on those benefits. When a person has wronged another, he or she has a duty to make reparations or right the wrong. Character traits are a disposition to act a certain way. Well, how are we supposed to act? As administrative medical assistants, billers, coders, receptionists, whatever our job position is, what traits or dispositions are we supposed to have in that job title? Well, first of all, we've been learning about being empathetic, we've been learning about being sympathetic, and we've been learning about being professional, kind, and courteous. If you apply that to every situation, I don't think you're going to be able to go wrong. But first of all, you must always remain professional. Types of ethical problems: ethical distress, ethical dilemmas, dilemmas of justice, locus of authority issues. Okay, so we're going to talk about each of those. So ethical distress is a problem in which a certain course of action is indicated, but some problem, barrier prevents that action. Ethical dilemma is a situation in which an individual must make a decision about two or more acceptable choices. However, choosing the one of the choices means that the person cannot follow through on the other course of action. Okay, we've all had ethical dilemmas at one time or another, even if you don't realize it. Let's talk about if you were in high school and you knew another student was cheating, and you knew about this, and you have a very strong belief that you shouldn't cheat. It's an ethical dilemma because you don't want this person to be mad at you, but you don't feel like it's fair that that person is cheating. And so that's a dilemma. You have to make a decision on whether you're going to follow your own ethics and report the student for cheating, or if you're going to not follow your own personal ethical system and say, I'm just not going to focus on what that person is doing. Dilemma of justice is when a problem focuses on the fair distribution of benefits to those who are entitled to them. In a locus of authority issue, two or more authority figures have their own ideas about how a situation should be handled. Now you're thinking, well, what in the world would that have to do with me working in a facility? Well, what if you have two doctors in the facility and one doctor wants something done this way and the other doctor wants something done that way, and there's no middle ground? Well, that's going to be an issue because you're going to say, okay, what rules do I follow? Never have I encountered that, but that would be the locus of authority. Ethical decision-making process. You're going to gather relevant information. You're going to identify the type of ethical problem, determine the ethical approach to use, explore the practical alternatives, and complete the action. Okay, here we go. We're going to get into it a little bit deeper. To gather information, a medical professional should ask questions, review charts, talk to the patient and other professionals, and search for the other data so that the entire situation is available for scrutiny. Scrutiny, not scrutiny, sorry. In determining the ethical approach to use, we must consider the duties, rights, and character traits of all the individuals involved, paying close attention to the ramification of all possible decisions. Those entering the medical profession should take stock of their core beliefs, scan the newspapers, and search professional journals for ethical situations, think about the facts, then decide how you would react to each one. A lot of these things that I'm looking at ethics-wise, and gathering information and doing all of this, I really see more in a management position, but not always. The Council on Ethical and Judicial Affairs, that's CEGA. AMA stands for the American Medical Association. Please, please, please commit that to memory. AMA, American Medical Association. And the CEGA stands for Council on Ethical and Judicial Affairs. The AMA principles of Medical Ethics has been revised several times to take into account developments in medicine, but the moral intent and the overall idealism of these principles have not changed. Develops ethics policies for the AMA by analyzing, addressing ethical issues that confront physicians and the medical profession. AMA Code of Ethics, 9 separate categories of ethical concerns. The CGA opinions on social policies and issues, preventing, identifying, and treating violence and abuse, HIV testing, withholding or withdrawing life-prolonging treatment, organ donation, and allocation of health resources. The complete opinions of the CEGA can be found in your textbooks. The law requires that physicians report abuse. If they don't, it's a breach of ethical standards. Physicians should promote routine HIV screening for all adult patients, and providers must attempt to prevent HIV-positive individuals from infecting third parties. The decisions to withdraw life support should be made before any mention of organ donation is made by the medical professionals tending the patient. Organ donation is encouraged by the AMA. So let's ask a question. What are the criteria for allocating resources? Urgency of need, likelihood of benefit, duration of benefit, amount of resources required for successful treatment, and potential for life change in the quality of life. Okay, CEGA opinions on confidentiality, advertising, and communications. Confidentiality is the restrictions applied to information documented in a patient's record. Advertising publicity must be true and not misleading. Publicity, certain kinds of news are not of public record. Provider cannot discuss any patient's condition with the media without authorization for the patient or patient's legal representative. Confidentiality is one of the cardinal rules of the medical profession. HIPAA has established strict rules for patient confidentiality and disclosure of private health information. Guys, you have to maintain confidentiality. If you cannot be confidential, then you need to look for a different field. You have to be confidential. CEGA opinions on practice matters. Fees and charges. Charging or collecting an illegal or excessive fee is unethical. Fee splitting and contingent fees. Payment by or to a physician solely for the referral of a patient is fee splitting and is unethical. Waiver of insurance co-payments, conflicts of interest, and unethical conduct by a member of the health profession. Okay, there are a ton of acts and laws, and they are very, very important for when you take your NCCT exam. I know that some of you have been through those with me quite a bit, and some of you have not, but I will be posting laws and ethics, some information, some definitions that I have put down that I think are important. Those will be upcoming, so I just want you to know that. The medical assistant is responsible for keeping informed about current billing regulations and for seeing that these regulations are followed consciously. Providers may opt not to charge or may offer a reduced rate for care given to physician, staff, or family members. This is called professional courtesy. AMA recommends that physicians not meet the pharmaceutical and medical device sales representative except by documented appointment and that the physicians express invitation. Before making a judgment about unethical conduct, medical assistants must be absolutely sure of all the information and circumstances. That's where your document or your information gathering would come into play. Closing comments. Medical developments affecting patient care, honest appraisal of benefits, environment and upbringing, beliefs must be our own, and importance of confidentiality. Membership in a professional organization provides access to continuing education for maintaining knowledge and skills pertaining to the performance of medical assisting. Medical assistants should take a serious look at the thoughts and concepts that make up their own concepts of ethics. It is important to approach ethical decisions calmly, logically, and without haste. Confidentiality is always critical, and the medical profession and patients must understand ethical standards. Patient education and legal and ethical issues. Regardless of the situation, the medical assistant is bound by ethical standards to treat all patients with respect and to make ethical decisions based on principles rather than your personal belief systems or values. Patients may not always understand the ethical standards to which providers and medical assistants adhere, and your prime objective of the healthcare profession is to render service and provide quality care to all individuals. Okay, so that is our slideshow. I want you to be expecting, it's going to be just a medical doc. Microsoft, guys, help me with my tongue-tiedness, sorry. Is going to be a Microsoft Works document that I'm going to be sending. I really want you guys to read it, know it, know it, know it. And we'll be going over and over and over it for you guys who've not been with me for very long. We're going to be going over those laws and acts just all the way through the course. Okay, so I hope you guys have a good day, and I'll be talking to you later. Bye-bye.